everyone. Today I'm going to present on snake envenomation and management of snake bite lah in ED. Supervised by Dr. Vilasini. Outline for our presentation today, we're going to cover on classification of snakes, family of venomous snakes, pathological effects of the venom, clinical assessment, management, also anti-venom. So the epidemiology of the snake bites, around 75% of snake bites mainly dekat utara lah, Perlis, Kedah and Penang. Around 60% are due to the Malayan pit viper. And also the poisonous snakes yang common lain adalah cobra and also crickets. Mortality rates of snake bites about 0.1% to 1.6%. So we can classify snakes into venomous snakes and also non-venomous snakes. Venomous snakes selalunya characterized by ada triangular head, elliptical pupil, heat-sensing pit, ada fangs, venom duct and venom gland. Non-venomous snakes selalunya dia punya head dia rounded, round pupil, dia tak ada heat-sensing pit, tak ada fangs. So this one, as you can see in the pictures, based on the mark sites, kalau bitten marks tu, kalau venomous snakes may or may not lah ada single fang mark ke double fang mark, kadang-kadang tak ada je. And as compared to non-venomous snake, dia tak ada fang marks. Dia like macam apa dia? Hello? Okay. Okay, 5 common genera of venomous snakes in Malaysia include pit vipers, cobras, crickets, coral snake, also sea snake lah. These are the apparatus of venomous snake. So as you can see here, just for information lah, dia punya okay, apparatus of venomous snakes, they include ada compressor muscle kat belakang tu, venom gland, lepas tu ada venom duct, primary, secondary, and then they come out dekat venom canal, keluar seketui venom tu guys tu. Okay, family of snakes include ada banyak sangat. Ada sikit yang saya include dalam ni, ada Colubridae, Elapidae, Viperidae, Hydropidae. So we gonna cover on Elapidae, Viperidae and Hydropidae sajalah for today for venomous snakes. Sebab Colubridae is non-venomous snakes lah. Okay. Elapidae, they characterized by long, thin with large, smooth, symmetrical plates dekat top of the head. As you can see here, dekat gambar ni, dia punya tops of the head dia flat lah. Ada short front fangs, tak ada loreal scale. Kalau you can see dekat mata dia tu, dia pre-auricular and nasal scale dia, between that tak ada. Kalau nanti nak kita compare dengan Viperidae, dia ada satu macam loreal pit dekat in between the nasal scale dengan preauricular scale. In cobras pula, kalau cobra dia ada hood, dia akan spread the flatten the neck, and then you can see the hood lah. Next is Naja sumatrana. Naja sumatrana ni ada dekat Malaysia, but then it's not common lah. Tapi dia akan spray its venom dekat mata anus tu. So common Elapidae dekat Malaysia, common black cobra, ular senduk, king cobra, tedung selak, banded crate, ular katam belang, Malayan crate, ular katam batu, blue Malayan coral snake and banded coral snake. So these are the pictures lah I'm going to show. Ular senduk, ular tedung selak, ular katam belang, ular katam bertebu, ular pantai biru-biru dengan ular pantai belang. So for the venomous snakes, we're gonna divide it into local effects and also systemic effects. For the Elapidae, dia punya main characterize dia neurotoxic lah, because dia ada neurotoxins. So local effects in cobras, as you can see inside the table, most commonly, more profound local effect is the cobras lah. Cobra will have very tense, very painful, and edematous, and also necrosis lah. And then the early sign of systemic envenoming includes the vomiting. And then kalau bila envenoming tu occurs and then ada neurotoxicity that may appear between 15 to 20 minutes or may delay lah for many hours. Patient may have symptoms of blurred vision, circumoral and gum paresthesia, hypersalivation, also drowsiness. Also kalau bila dah start ada early signs of neurotoxicity, which is the ptosis, and then may progress further into paralysis of outward gaze, total external ophthalmoplegia, unable to open mouth, protruding tongue, difficulty in swallow and speak, and also respiratory muscle paralysis. And lastly is the generalized flaccid paralysis. When this happen, when early signs of neurotoxic happen is the ptosis, you must encounter cepat-cepat terus kena bagi antivenom lah, because it may progress. So these are the, nampak tak? Sana start. Next slide dia appear tak? Macam tak appear je. Okay. So, these are the examples lah. The patient, kalau local effects, the patient may have the tissue necrosis at the bite side. Also, the early signs of the neurotoxic is the ptosis lah. So, Viperidae. Viperidae can divide it into true viper or the old world vipers, Viperinae, or pit vipers lah, yang common dekat sini, Cotraline. They characterized by long fangs, normally folded against the upper jaw and erected during a bite. As you can see in dekat gambar belah kanan atas tu. The Cotraline ni macam I dapat mention just now, dia ada as compared to Elapidae, dekat gambar bawah tu nampak macam ada loreal pit between the nasal scale dengan mata dia. Nasal dengan mata dia, between tu ada loreal pit. That's why we call it is pit vipers lah. Okay. Common Viperidae, kita ada ular kapak bodoh, Malayan pit viper. Also the other one is the mangrove pit viper, ular kapak bakau. Yang ular kapak Sumatera not really common lah. So contoh, this one Malayan pit viper, ular kapak bodoh. Also mangrove pit viper, ular kapak bakau. Okay, Viperidae mainly Viperidae mainly dia punya toxic effect is the hematotoxic. Dia ada hematoxin. Tak ada slide kan? Okay, the local effects for Viperidae, it can cause severe persistent pain, intense swelling of the limb, blisters, and also slough and necrosis lah. For general symptoms, when there is envenoming, the patient may develop bleeding all over the body lah. Ada hemoptysis, ada hemorrhage under the skin and mucosal, gum bleeding, epistaxis, hematuria melina. And then may develop further to internal hemorrhage, cardiotoxicity, and also renal dysfunction. Okay, these are the pictures. Local effects may develop very tense pain, swelling, blisters, and also necrosis. And then there is also conjunctival hemorrhage, cum bleeding, and other bleeding also lah. So Hydrophidae, the last family of snakes that I'm going to cover lah. Most sea snakes have flattened paddle-like tails, and their ventral scales are greatly reduced in size or absent lah. So the examples are banded sea snake, hardweight sea snake, and also amphibious sea snake. So ni you tengok dalam ayat macam ada sea snake yang sangat cantik, hardweight sea snake. So Hydrophidae, kalau sea snake yang macam I dah mention just now, most commonly dia dekat laut dalam. Contoh dia Sabah ke Sarawak kalau that lah. Dekat Kedah memang uncommon lah. Hydrophidae, dia most commonly is the myotoxic. It can be the neurotoxic jugalah. Patient may have ptosis juga. Tapi mainly is myotoxic lah. Local effects for Hydrophidae, dia patient selalunya dia bila dia kena patuk je dengan ulang, tapi dia tak rasa sakit sangat. Little pain but no edema at the bite side. Selalunya jadi dekat orang nelayan yang tengah sorting fish net ke, tiba-tiba jumpa ular, lepas tu kena patuk. Lepas tu tak pun patient yang pergi diving laut dalam, so kena patuk pula. Other than that is myotoxic effects. Patient may develop general muscle ache, pains and also stiffness lah. And then also myoglobinuria, where patient akan bagi tahu dia ada dark coloured urine. And further may develop into hyperkalemia and renal dysfunction, may lead to cardiac arrest. So this table shows the summary of the local systemic effects of the Elapidae, Hydrophidae, and also Viperidae. So other than that, just nice to know, there is also non-venomous snake. Contoh dia python lah, yang most common dekat Malaysia. Green snake. Okay, case 1. 59 years old Malay man with no medical illness from village in Merbuk came to ED complaining of swelling in his left hand after an exposure to an unknown bite masa tengah gardening dekat house yard. Initial examination revealed patient fully conscious, stable vital signs, normal general physical examination, but upon local examination noted dia punya left hand ada edema, redness, warmth, swelling, tenderness, ada mark signs juga. Macam fang mark sign dekat left hand with dark tissues around. Okay. What do we need to know from the patient? So, we cover the clinical assessment. The history taking is very, 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 very important because we need to know the exact snake that bite the patient lah. So that the antivenom, kalau contohnya patient kena bite and then ada envenomation punya effect, kita kena bagi antivenom immediately. So for the history taking, kita kena tanya when it happened, how it happened, dekat mana kena bite, and then ada multiple bites ke tak. Lepas tu geographically kita boleh agak, kalau contohnya patient kena dia tengah macam hari tu saya pernah encounter patient ada dekat kawasan Paya Bakau tengah, tak pasti tengah buat apa, tapi dekat kawasan Paya Bakau. So kita boleh agak the patient might kena bitten by a mangrove pit viper lah. Alright. Okay, then we ask the symptoms what patient may have, and also examination. Okay, on the same time, PAP came and brought a plastic bag containing the culprit. it's easier for the patient kalau patient ada gambang ke, ada bawa ulang tu sendiri, dah mati ke tak mati ke, it's memang paling senang lah. Kalau tak ada, then kita kena try teka lah. Ada cara dia. Okay, I'll proceed with that later lah. You able to see the transparent black plastic bag. Lepas tu you see ada large snake macam yang tunjuk tadi, 10 inch long, 10 inch long, brown black in color. The erect forebody with spectacular outspread hood. Tak ada lorial pit. Third upper label scale enlarged. So what do you think is the snake? So you identify the snake as king cobra. So what are your next steps?
Ada siapa nak cuba jawab? What is the next step? Nafis nak try? Nafis?
Siapa dia kata?
Kita nak turun siapa ya? Izhar Faizul ya?
Izzah
Izhar Faizul. Izhar, nak try?
Hello, Doctor.
No man, just give a shot. No harm, we are in the learning process.
Next step, apa ni? Ambil further history, tanya
What the
bila
relevant history you want to ask? Ataupun nak assessment?
tanya dia
King cobra bite.
King Cobra bite. Assess dia punya luka dia. Tengok betul tak dia punya wound tu fang macam tu.
Kacau. Dari description dah ada kan? Ada King cobra bite kan?
Tu
So
fang.
in terms of science, what system are you going to give importance over here?
Cobra kan.
Cobra. Cobra dia kacau mana?
Neurotoxin.
Very good. So what are the signs you want to look for?
Local edema.
Okay.
Lepas tu tanya ada systemic symptom macam vomiting ke.
Okay. Kata neuro. Neuro nak look for what?
Dia punya neuro.
Starting from the eyes.
Blurring of vision.
Yes, when you want to look for the signs, you're going to look for the ptosis, muscle paralysis, respiratory depression. So you have acute respiratory distress, and then upper limb or lower limb paralysis. So it is important for more of a neurotoxicity sign.
Okay,
boleh proceed, Chut?
Alright. So in ED, when patient came with snake bites, you have to resuscitate the patient. You have to look for A, B, C, D, the airway, breathing, make sure it's patent, and then breathing problem. If there is breathing problem due to the paralyzing neurotoxic effect, you must immediately give the antivenom. Okay, assess the local wound, also the control bleeding as is necessary lah. For the general examination, as we all do, check the blood pressure, pulse rate, respiratory rate, SpO2, pain score, temperature, and by side examination, look for the wound, swelling, inflammation, bruising, and then you use the small micro pore tape for labeling instead of the permanent marker lah. Later I'll show the picture. So for this one labeling, it is necessary for you to measure the rate for the proximally extent of the swelling lah. It won't develop to the distally, faham ke? Okay. Other than that, you have to look for the lymph nodes, palpate for the tenderness, enlargement, because the venom will be drained into the lymph node side lah. Other than that is the systemic signs. Assess for general early non-specific features and also neurotoxic effect, the hematotoxic effect, also the myotoxic effect, rhabdomyolysis. So this, all of this, you need to do it serially because the patient may progress. Patient may also, apabila dah ada envenomation, may lead to paralysis. Okay. So we have the snake bite chart. As you can see here, serial assessments of the patient's clinical progression should be performed for the first 48 hours, which is the 2 days of the presentation. And catat dekat dalam snake bite chart macam ni lah. Alright, monitoring. Monitoring, apa yang kita nak monitor is the progression of the local tissue injury.
Sorry.
Yes.
The chart wasn't displayed just now. Okay, good.
This one. Alright. So this is the chart. We have the date, time, GCS, BP, pulse rate, SpO2, pencil, RPP, the rate of proximal progression of the swelling, also the tender lymph node. Yes or no, right? Okay. So these are the monitoring that we need to monitor. So as you can see here, tak ada. Alah, okay. So as you can see here on the top, right top, ada dia guna marker. Kalau kita macam, it's better to use the micropore punya tape. Okay, contohnya patient punya swelling dekat bawah tu, contohnya yang picture yang belah kiri tu, bawah sekali, yang belah kanan sekali. And then jangan letak micropore tape tu banyak-banyak macam ni. Maksudnya you start with one micropore tape, lepas tu bila dah develop lagi, letak another one tu, nak letak lagi satu, lepas tu buang yang satu tu. Kiranya you can see the progression. Okay. Tapi let's say, is it betul doktor kalau let's say the progression is more than 3 cm in 1 hour, we have to start anti-venom? Dr. Vila, mic off.
Okay, more than 2 and above.
More than 2 and above.
But in general, later I will tell you all, sometimes swelling per se is not the only indication for us to initiate the anti-venom. Another person tak sakit. And you can see the local systemic envenomation is not established yet. But you see the swelling is there. It's like about 2.5 to around 3. But patient general condition, his pain threshold, everything is still within the range. So you may talk to the superior or like your emergency physician to identify whether this patient required the anti-venom tak. Okay, it goes as a constellation symptom and signs whether you want to start anti-venom. Because anti-venom per se is not a simple drug, you know, it's highly constitute protein content. So you really have to outweigh the benefit and risk whether the patient required or not.
Okay. So investigations. Next, investigations in snake bite. So we're going to take coagulation profile, FBC, urine profile, CK, urinalysis, LFT. These are important because in hematotoxic, like Viperidae punya snakes, hematotoxic will have effect in coagulation, like the APTT, PT, and INR will be prolonged, fibrinogen level and D-dimer also can be sent if available. LBC, platelet count will be decreased in Viperidae punya snakes when envenoming. Also LBC, kalau hasil LBC ada river drop of hemoglobin, meaning patient ada bleeding lah. And then renal profile to see if there is acute renal failure, AKI, like serum creatinine will be high lah. Other than that, hyperkalemia, potassium in extensive rhabdomyolysis. CK also will be high in rhabdomyolysis if you detect it's a myotoxic punya hydrophidae lah. Urinalysis to assess for myoglobinuria, hematuria, also proteinuria, and then LFT kalau ada malhepatic dysfunction lah selalunya, because the serum enzymes release because of the local muscle damage. Also kalau buat ECG may detect arrhythmia, especially in patient in species Naja cobra lah. So next, this one 20-minute whole blood clotting test. Is it? Kalau tak keluar. Okay, 20-minute whole blood clotting test. Is it necessary for all patients of snake bites? Anyone? Okay. So for the 20-minute whole blood clotting test, usually we do to patient yang kita unidentified bite ataupun when a pit viper is suspected bila kita nak. Tapi kalau contohnya pit viper tu dah terang-terang kita tahu, kita tak perlu buat dah. Because we know already. Because this one is you want to confirm it's either it's pit viper ke tak, so that in the future you can. Alah, hai anak agak kecil. Sekejap doktor. Sekejap je, okey? Kejap je, okey? And then kalau this one 20-minute whole blood clotting test, selalunya kita akan ambil dalam bekas kaca tu about 1/3 darah. And then if let's say within 20 minutes the blood tak clot, meaning dia ada coagulopathy lah, dia ada might have viperidae punya tu. So kita boleh suspect is pit viper bites. Okay. So this one, the blood investigation serially that we have to do lah. LPD, pit viperidae, snake and identified. Kalau IBC, kalau pit viper tu 6 hourly lah, because hematotoxic effect kan. Coagulation profile, CK also 6 hourly. So these are the serial blood results every 4 to 6 minutes for the first 24 to 48 hours. For LPD bite, tak perlu serial coagulation profile lah, unless it is indicated. So management in snake bite. So first aid when it happen dekat site. Kalau kita dekat situlah, patient selalunya kita akan make sure the bitten part is immobilized. Kita boleh tolong immobilize with sprint or sling. Kalau ada tourniquet ke compression ke, kalau kita ni tak perlulah letak tourniquet, because this one can cause gangrene and increase because the arterial blood flow will decrease lah dekat kalau kita tourniquet dekat bite side tu. So the only indication for the use of in case basically kalau dekat site tu apa yang kita perlu buat, immobilize. Lepas tu kalau tourniquet, jangan letak tourniquet, and then terus bawa patient pergi hospital. Okay, kalau dekat ED, what we need to do as patient dah sampai, make sure resus dulu, ABCD tu make sure okay, and then take detailed history, and then you give IMATT and just antibiotics. So you have to evaluate lah. These are the apa orang panggil ni je simple say lah. The management of snake bite, what we have to do is kita bagi ATT macam I bagi tahu tadi. Kalau macam contohnya patient viperidae punya patient pit viper snake bite, jangan bagi IM injection because patient may have the hematoma formation lah, because dia hematotoxic kan. Kalau contohnya ada venom exposure by Najah sumatrana tu, kita perform eye irrigation. Kalau for the pain, we give NSAID. Tapi kalau kita bagi NSAID dekat macam patient yang ada coagulopathy, should be avoided lah. Antibiotics should be considered in snake bite with local, kalau dah start ada local tissue necrosis, dermonecrosis dengan extensive tissue injury or damage lah. Lastly, antivenom. Okay, during observation dekat ED, patient showed no clinical deterioration. Blood investigation taken showed normal value. However, the swelling over the left hand progressing proximally from the wrist joint. Do the patient need for the antivenom now? Okay, so this is the indication for antivenom treatment. So we have the systemic envenoming dengan local envenoming. For the systemic envenoming, if the patient started to have hemostatic abnormalities such as spontaneous systemic bleeding, coagulopathy or thrombocytopenia, kalau patient ada neurotoxic effect macam ptosis, paralysis, impact consciousness and then cardiovascular abnormalities, patient start hypotensive, shock, cardiac arrhythmia, AKI, ada myoglobinuria and then ada evidence of rhabdomyolysis or hemolysis where patient ada muscle ache ke apa ke, ada hyperkalemia, rapidly raising CK level, kita bagi antivenom. So for local envenoming, when patient may have more than half of bitten limb within 48 hours. Swelling after bites on the digits. Rapid extension of the swelling, macam tadi doktor kata, within 1 hour, more than 2.5 cm, 2 cm, dah consider as cepat lah, progression yang cepat. So we need to give local envenoming. So when to give antivenom? Antivenom should be given as soon as it is indicated. Criteria for repeating the initial dose bila patient still having the persistent or recurrence of the blood coagulopathy after 6 hours, persistent or recurrence of blood bleeding after 1 to 2 hours, lepas tu neurotoxic and cardiovascular signs deteriorating after 1 to 2 hours, and then ada compartment syndrome after 6 hours. So choice of antivenom. Antivenom kita ada dua jenis. Satu monovalent, satu polyvalent. Monovalent is where the species is known, which kita tahu it's cobra ke, it's pit vipers ke. So it is a monovalent antivenom. Kalau polyvalent antivenom kita give to patient yang species is unknown. That's why snake bites, it is important to know the snakes because the antivenom is bukan murah ya, sangat mahal. Okay. Alright, this one contoh antivenom, we have monovalent, contoh dia yang cobra antivenom, king cobra. So how much you want to give? Kalau patient ada local envenoming, about 5 to 10 vials. Kalau systemic envenoming, kita bagi 10 vials. Kalau king cobra, like macam tadi kita punya case sekarang ni, kalau ada envenoming punya effect, kita bagi 10 vials of king cobra punya antivenom. Okay, this one Malayan pit viper, about 3 to 5 vials, and then sea snake, about 1 to 3 vials for mild to moderate. Severe envenoming, kita bagi 3 to 4 vials. This one contoh polyvalent, ada neuropolyvalent dengan hematopolyvalent. Okay, how you want to administer antivenom? You ambil the antivenom with 10 ml WFI, gently you swirl, tak nak shake, you nak dissolve the freeze dried powder and then you further dilute all the solution dengan hypertonic crystalloid lah. Kalau contoh untuk for children, bagi volume dalam 5 to 10 ml per kg. Kalau for adult, dengan normal strength 250 to 500 cc lah. So you infuse slowly. First, you infuse slowly about 1 to 2 cc per minute for 5 to 10 minutes, and then observe sign and symptoms of early anaphylaxis. Because antivenom ni jarang sangat kita bagi, so takut patient develop anaphylaxis. So bila dah kita observe tu, bila ada reaction towards the antivenom, patient started to have rashes ke, urticaria ke, SOB ke, stop the administration immediately. Lepas tu kita bagi adrenaline, piriton dengan hydrocot. Adrenaline kita boleh bagi 0.01 mg per kg for children, 0.5 mg for adult. IV piriton kita bagi 10 mg lah for adult macam biasa, and then 0.1 mg per kg untuk budak. IV hydrocot kita bagi 200 mg untuk adult, 4 mg per kg untuk children. Kalau let's say the reaction resolved, dah okay, kita resume balik the administration of the antivenom lah at a slower rate daripada tadi. Tadi kita bagi 1 to 2 cc per minute. Maybe kita wanna give half lah, 0.5 cc per minute. Okay. If no reaction appears, kalau tak ada apa-apa, kita increase the rate. Kita bagi cepat sikit. 5 to 10 cc per minute to complete in less than 1 hour. And then kita observe. Kita keep on observing lah. Because kita giving antivenom yang sangat-sangat tak pernah bagi ke orang. For at least 2 hours after completion of antivenom administration. Okay. During first 10 minutes of antivenom administration, patient suddenly develops SOB and then BP becomes hypotensive, SpO2 less than 90% under room air. Patient also continue skin itchiness. What happened actually? What do you do?
Can someone to answer this question? Boleh? Any taker dah jawab dulu tak? Kamal ada? Kamal? Wong, you wanna try?
So after 10 minutes, the antivenom looks like the patient is having allergic reactions. Do we stop and then give hydrocot?
When you declare it's allergic or anaphylactic?
Because of the skin itchiness, can we think it's anaphylactic? Or we don't know?
Okay, you don't think this is anaphylactic? Or it's as simple as that?
Yes, it could be because of the drop of SpO2.
So which medication you want to give to the patient first? Hydrocot, piriton, or adrenaline?
Adrenaline.
So you have to give rapidly. Do not think further. If there is evidence of significant SpO2 drop or blood pressure drop, or patient's GCS, or patient complain of a simple feature, I have felt a foreign body sensation over the throat. Is that a normal or not? It's a totally abnormal symptom to be present by patient during the antivenom being administered. So you need to give the patient IM adrenaline. If it's adult, we prefer to give 0.5 mg. As tadi mention kan, dia punya dose to 0.1 mg per kg kan? Okay, in general, for adult patient, the standard dosing will be 0.5 mg. IM, you have the anterior immediately. Then followed by IV hydrocot and piriton. Okay? Do not hesitate to give the adrenaline in this group of patients. Thank you.
Okay, that's good.
Okay. Okay, later on, the anaphylactic symptoms resolved. Antivenom administration resumed. And then as you plan for disposition of the patient under medical, suddenly patient complaining of severe pain of the affected limbs, which is swelling now reach the forearm. What do you expect? What is your management and management? What is your assessment and management? So upon examination, kita notice there is tense swelling dekat left forearm with glistening of the skin. So you can suspect it's a compartment syndrome. So you have to assess the 5 P's: pain, patients start to have pale skin tone, numbness, feeling, pulselessness, and also weakness, paralysis. So we have to give analgesia, and also we refer ortho immediately for urgent fasciotomy. So these are the observation that we need to do for in response to yes.
Can we go back to the previous slide?
Yes.
Okay. Regarding this fasciotomy in snake bite, if you are the snake professionals who are dealing with the snake bite envenomation, the swelling is basically due to the envenomation. True or not? Agree?
Yes. Yes.
Okay. So very close monitoring of the swelling to identify the early compartment syndrome is extremely necessary. Why? That will lead us to the initiation of the antivenom. Okay, bila dah bagi antivenom, peluang for the swelling to reduce is extremely high. We can even prevent the fasciotomy, especially in snake bite.
Right.
Okay, so if you ask the snake bite professional, they have different school of thought. Under ortho, it will be different school of thought. Okay, but yes, it is a must for ortho team to review, and they will decide when the fasciotomy will be taken place. But once if we give an appropriate antivenom to the exact identified bite, you can reduce or prevent. Hampir most of the cases currently, if you discuss with the rec team and everything, we can avoid the fasciotomy. Because if you encounter patient yang pernah melalui fasciotomy, dia punya lifestyle ataupun dari segi the healing process of the wound is not easy. Because the amount of tissue that you need to remove is extremely a lot. The circumference will be a lot.
Yes.
So bukan senang nak heal wound tu So it's better to prevent in general. Okay?
Alright. Okay.
Okay.
Okay. Next, the observation of response to antivenom. Generally, we have a patient may have less nausea, headache, generous ache pains, and then spontaneous systemic bleeding. Bila the antivenom kita dah bagi, the bleeding may stop within 15 to 30 minutes. Blood coagulability also restored in 3 to 9 minutes. In shock patients, increased blood pressure within 30 to 60 minutes. Active hemolysis and rhabdomyolysis may also cease within a few hours. So you can see how significant is the antivenom in case of envenomation of the snake bites. So specific management of complications like for the compartment syndrome is rare, and we memang kalau boleh kita avoid the urgent fasciotomy. That's why we need antivenom.
So these slides explains how good is your antivenom.
Yes.
But bear in mind, it has to be specific to the identified specimen.
Alright, okay. Alright. Dah. Finish. Okay, thank you.
Thank you very much, Chut. Any question from the audience? Boleh Dr. Wila tanya soalan pula? Okay, this is for everyone. Anyone can take up and answer the questions. Okay, let's say a person about 40 years old sustained snake bite. We suspect it's a Malayan pit viper, which is the person describes is just as long as 10 centimeter. Nampak macam anak kecil je, baby snake or what, doctor. And patient is having a swelling. And you think that patient's swelling is more than 2 centimeter per hour. Do you need to initiate an antivenom for this patient? And he's persistently telling it's just anak ular.
Anak ular.
Tacha is there? Tacha?
Yes, doctor. I think
Baby snake.
I think I need to give, because from what I heard, usually the baby snake will give the full venom when it bites you.
Wow.
I don't know how true is that, doctor.
Something new I heard. It gives the whole entire venom, huh?
Yeah.
So you want to give also, huh?
Yes,
Okay,
doctor.
the others agree you want to give the antivenom? Setuju tak? Anak ular je dia batuk. Bukannya mama dia batuk. Okay, in general, apart from the family history, siapa patuk, it's not the issue here. It doesn't matter it's a small snake or baby snake or the adult snake. The amount of the amount of venom being injected to the patient is same amount. So there's no discount in the antivenom. Everyone requires antivenom if there is indication, either systemic or local envenomation. Okay, my next question. Patient dipatuk oleh Malayan pit viper. Yeah, because his surrounding is as such, and then he saw the ular kapak bodoh lepas patuk duduk kat sana je. True or not? Most of the time the histories are just like that, right?
Yes.
Okay, and unfortunately he didn't bring the snake. Okay, and your history does not fit exactly to the expected history you are requiring. What will be your next step? You understand what I'm telling to you?
Yes. Meaning they're unsure it's either pit viper.
But he is very confident that he's telling that.
But the history is not suggestive.
Yes. Is that possible or not?
Possible?
Possible, huh? Okay, so don't be very strongly believe what the patient said. He is mentioning is Viperidae group of Elapidae group of bite, especially he's describing is Malayan pit viper. But the history is more to the CNS manifestation. So again, go back to your sign and symptom. You group it in a order form. You see which group does it fall. If it does not fall to Elapidae, do not give the antivenom. Discuss with the rec team, or discuss with your superior, your physicians, emergency physician. See whether it's a true Elapidae or it's a Viperidae. Okay, possible tempat tu ada 2 ular. Dia dipatuk oleh ular senduk. Ular senduk dah pergi dah. But yang ada kat sana ular bodoh tu. You end up treating for the Viperidae. Okay, that has happened. So be cautious, very, very cautious. Okay, my next question will be apa dah tanya na? Yeah, Chut mention about the 20-minute clotting time. It's not for everyone, ya. Dr. Vila selalu perasan ada je kat botol tu dalam yellow zone, kan? But who did? Oh, doktor dah tahu dah snake apa. Then why we did? It's not necessary, yeah. But you can use this as a tool if you're working at clinic kesihatan level. You know, patient mentions unidentified snake bite. You can do the 20-minute clotting time. It's a very simple procedure with very simple tools beside you. You just need a glass clear bottle. Aspirate, obtain blood from the patient about 10 ml, and then you wait for 20 minutes. If it's clot, it's a normal physiological process lah. Kalau dia tak clot, it's a lacking of coagulopathy punya coagulation factor inside the blood. Okay, very good. What I want to ask, one more question. Okay, in ELAPD, should I describe how to identify, right? There's one important identification which I'm missing, which is your monoclot. The appearance of the dark circle at the head of the Viperidae. Ada gambar dah Chut tadi?
Viperidae ke Elapidae?
I'm sorry, ELAPD.
Elapidae.
Ada gambar belakang tak? Ular tu.
Gambar.
I think I don't see one. The moment when they spread their hood, at the back of their hood, you can see a dark circle at the center of the head. That was one of the identification for your ELAPD. Ulat sendut,
Naja Kosha.
Naja Kautia. Yes. Yeah, you have the front view. I need the dorsal view. I need the posterior view. Okay. Chut, actually the Naga Sumatera is quite famous in our country. Don't be surprised. Actually, it's quite famous in our country. So, bila kita identify snake bite kan, kita kena tahu siapa jiran kita semua. On the top will be your Taiwan, at the side, on the both side, here will be on your left hand side will be your Indon. On the right hand side will be your Borneo. So you need to know what is the common snake in these countries also, because they tend to masuk juga dalam kita punya negara. Okay? Okay. And about the antivenom, bear in mind it's very highly constitute of protein content. So you really need to identify the patient fulfill the requirement or not, because you're introducing another high content of possible patient develop anaphylactic reaction. Okay? That's overall a very good presentation, Chut. Thank you, everyone.
Thank you, Doctor.
Can we move to the next presentation? Bashir is there?